Hello and welcome to our podcast on teaching adolescents with autism. Autism is a lifelong neurodevelopmental disability that affects the development of the brain in areas of social interaction and communication. People with autism have difficulties in communication and forming relationships with people, in developing language and in using abstract concepts. It also impacts on their ability to make sense of the world around them. Autism is described as a spectrum disorder. This means that the symptoms and characteristics of autism can present themselves in a wide variety of combinations and can range from mild to severe. Two people with the same diagnosis can act very differently from one another and have varying skills. Autism is often referred to as a hidden disability because people who are on the autistic spectrum show no significant physical difference to their peers. Rather, it is their behaviours that mark them out as different. People with autism have difficulties with both verbal and non-verbal language. Many have a very literal understanding of language and believe precisely what people say. It is important to understand that no single behaviour is indicative of autism, nor will a child show all the behaviours listed. The significant factor is a pattern of behaviours. Some of the behaviours may be intense while others are relatively mild. Some of the behaviours that indicate autism are seen at specific times in a typically developing child. The significant difference in autism is the intensity of the behaviour and the persistence of the behaviour beyond the normal developmental time frame. The first of the three teaching methods we are going to talk about is PECS. PECS was developed in 1984 by Laurie Frost and Dr. Andrew Bondi. The Picture Exchange Communication System allows those with autism who have almost no communication abilities a means for communicating non-verbally. The system is built on the established psychological principles of ABA, which include shaping and reinforcement. PECS is a practical communication system that helps develop important communication and social skills. PECS is a form of communication using pictures. People with autism are taught to approach other people by using these pictures of a chosen item in which they want in return of that item. By doing this process, they are able to communicate. By using PECS, they are able to communicate a thought, request, or anything that can be presented or represented through a picture card. PECS can be used both at home or in a school setting. There are 6 phases of the Picture Exchange Communication System. Phase 1. Learn how to communicate. They learn how to communicate through the means of the pictures. Phase 2. Distance and persistence. They learn to use the pictures in different places as well as with different people. Phase 3. Picture discrimination. They must learn to choose from more than one picture to ask for something. These pictures are put into a book known as a communication book. It has a ring binder and Velcro straps so the pictures can be stored and easily removed when needed. Phase 4. Sentence structure. The person with autism learns to form easy sentences on a detachable sentence strip. These include using I want picture followed by a picture of the item they are looking for. Phase 5. Answering questions. They learn to use PECS to answer questions like, what do you want? Phase 6. Commenting. They are taught to comment in response to the question asked. Example of question. What do you see? What do you hear? What is it? Etc. They then learn to come up with a sentence starting with I see, I hear, I feel, I want, etc. In a blog called To PECS or Not to PECS, a woman talks about her son who has autism. She states the key to lessening the impact of autism on her son's life was speech therapy. Her son's therapist recommended to try PECS. Evidence has shown that rather than replace verbal speech, PECS actually enhances and progresses verbal speech. She tells us that PECS has improved her son's language skills. She mentions that he no longer uses PECS, but keeps them under his bed if he ever needs them. She quotes, PECS was the key that started the engine, and he's been humming along ever since. The second method we're going to talk about is TEACH. TEACH was developed by Drs. Eric Skopper and Robert Reichler in the 1960s. TEACH developed an intervention approach called structured teaching, an array of teaching or treatment principles and strategies based on the learning characteristics of individuals with ASD, including strengths in visual information processing and difficulties with social communication, attention, and executive function. In response to this profile of strengths and challenges, structured teaching includes external organisational supports to address challenges with attention and executive function, visual and or written information to supplement verbal communication, and structured support for social communication. Structured teaching is not a curriculum, but instead is a framework to support achievement of educational and therapeutic goals. The framework includes physical organisation, individualised schedules, work activity systems, and visual structure of materials and tasks and activities. The goal of structured teaching is to promote meaningful engagement in activities, flexibility, independence, and self-efficacy. It helps integrate structured teaching strategies into other evidence-based practices. An article in the Journal of Intellectual Disability and Research called Benefits of the Treatment and Education of Autistic and Communication Handicapped Children Teach program as compared with a non-specific approach. Two educational treatments were compared, the Teach program and the Integration program for individuals with disabilities. Two groups of 8 subjects were matched by gender, chronological and mental age, and nosography diagnosis. The Teach program was applied to the experimental group, while the control group was integrated in regular schools with a support teacher. The psychoeducational profile revised and the Vineland Adaptive Behaviour Scale were administered twice within 1 year interval between assessments. Results: the scores of the experimental group increased more than the control group scores. Statistically significant differences were obtained in both groups because of the differences in the two approaches. The final method we are going to talk about is cognitive behavioural therapy and managing anxiety in the classroom for students with ASD. Research indicates that anxiety-related problems are amongst the most common presenting problems in school-aged children with ASD. Research suggests that cognitive behavioural therapy is an effective method of intervention for children with ASD. It is very important to recognise as teachers that the majority of adolescents coming into secondary schools or other schools will suffer from a certain amount of anxiety. Research has proven CBT to be effective in reducing and stabilising levels of anxiety within adolescents with ASD. Teachers who will encounter teaching a student with ASD should have some knowledge of the benefits and methods involved in CBT. CBT focuses on irrational thoughts and applies techniques to improve thoughts. Through research, it was recognised that CBT could also be an effective therapy and that CBT methods could be incorporated into teaching adolescents with ASD. The research uses a precise framework to comment on the delivery aspects of the cognitive approach. The precise framework is a set of objectives that practitioners should consider when using a cognitive approach with a child or young person. Research has shown that ASD adolescents are able to distinguish thoughts, feelings, and behaviours and work on altering their thoughts. The difficulty lays in how the adolescents could express their emotions. Techniques for following the children to express their emotions were experimented with, and the use of imagery and signs were the most effective way. Teachers would use images for children to point to and expressing their moods or emotions. Lack of motivation and attention can be obstacles when teaching adolescents with ASD, and so teachers and therapists would focus on a child's particular talents or primary interests as a break from the CBT teaching methods in order to keep the children focused and to give them a small break. Here are some tips for teachers teaching adolescents with ASD. Simplify the classroom environment by reducing the amount of competing sensory input. For example, reduce background noise and the amount of visual inputs. Use of visual strategies to reduce the reliance on complex verbal instructions. The effect of the volume of the teacher's voice against competing background noise should be further explored. Classroom acoustics should be considered. Reduce unpredictable touch input. For example, seat the child at an appropriate distance from classmates. Increase predictability in activities. Present information at a slower pace. Our awareness of ASD has grown over time. Today, ASD is recognised as an independent neurological based disorder, a major public health problem and a topic of much research. Despite struggling to find a cause, research continues in many sophisticated directions. Numerous treatments and teaching methods have been developed that help children with autism to maximise their potential to learn and become socially fluent, no matter how impaired they may be.